Hi everyone, and welcome back to the Pharma Mind. Many people hear the word fatty liver for the first time during a routine scan, and the reaction is usually confusion. I don't drink alcohol. I eat normally. So how can I get fatty liver? To understand fatty liver properly, we need to move away from fear and look at what is actually happening inside the body. Fatty liver is not something that suddenly appears overnight. It develops quietly, over time. Under normal conditions, the liver contains a small amount of fat, and that is completely normal. The problem begins when excess fat starts accumulating inside liver cells, beyond what the liver can safely manage. These fat droplets slowly occupy space inside the cells, interfering with how the liver processes nutrients, hormones, and toxins. In early stages, the liver continues to function well. That's why fatty liver is often discovered accidentally, during an ultrasound or a routine health check, even when a person feels completely fine. One of the most common questions people ask is, why do I have fatty liver if I don't drink alcohol? This is an important question. Alcohol is only one cause of fat accumulation in the liver. Today, the more common cause is metabolic stress. When the body is repeatedly exposed to excess calories, refined carbohydrates, sugary foods, frequent snacking, and low physical activity, the liver is forced to process large amounts of glucose and free fatty acids. When the body can no longer store energy efficiently elsewhere, the liver becomes a storage site by default. Insulin resistance plays a key role here. When insulin signaling becomes inefficient, fat metabolism is disrupted, and fat begins to accumulate in the liver. This is why fatty liver is closely linked with conditions like prediabetes, type 2 diabetes, and metabolic syndrome, even in people who never consume alcohol. Inside the liver cells, this process is not passive. As fat builds up, cellular energy systems become strained, oxidative stress increases, inflammatory signals may begin to appear. The liver works harder to maintain balance. In some people, this stress remains controlled. In others, inflammation develops, a condition known as steatohepatitis. Importantly, this progression is not automatic. It depends on metabolic health, genetics, and ongoing lifestyle signals. The liver is resilient, but it responds directly to the environment it is placed in. Another confusing aspect of fatty liver is the absence of symptoms. The liver itself does not have pain receptors. Early changes do not trigger obvious warning signs. That's why many people with fatty liver feel completely normal. Some may notice vague symptoms like fatigue, heaviness, or mild discomfort on the right side of the abdomen, but these are nonspecific and often ignored. The absence of symptoms does not mean the liver is unaffected. It means the liver is still compensating. So, is fatty liver dangerous? The answer is, it depends on progression. If fatty liver remains mild and metabolic stress is corrected, the condition is often reversible. The liver has a remarkable capacity to recover when the underlying causes are addressed. However, if fatty liver is ignored for years, inflammation and fibrosis can develop, increasing the risk of long-term liver damage. The danger lies in delay and neglect. Many people hope for a tablet that can clean fat from the liver. At present, no medication directly removes fat from liver cells in a sustained way. Medicines can help control associated conditions like blood sugar or cholesterol, but they do not replace metabolic correction. Lifestyle signals matter more than pills because they directly influence how much fat enters and leaves the liver. Consistent physical activity, improved insulin sensitivity, balanced calorie intake, and reduced refined sugars all send corrective signals to the liver. This is not about extreme dieting. It is about restoring metabolic rhythm. Fatty liver is not a sudden failure of the body. It is a signal that the liver is adapting to ongoing metabolic stress. When understood early, fatty liver is manageable and often reversible. If you found this video helpful, don't forget to subscribe.